apnea, and 25% of middle-aged men, something that is surprising. At least 70% of people, and you think, well, it's not just a crummy night's sleep, I don't feel very good during the day. There are real health consequences. First is cardiac, for your heart. Really bad for your heart. At least half these people have high blood pressure or will develop it. It's a big jolt when you stop breathing multiple times in a minute when you wake up. The other issue is that this is actually a biological arousal for your body, so that fight or flight response, so stress hormones are being pumped out all the time when you have sleep apnea, and that's not a good thing.
Oh, intriguing research, Dr. Raj, that maybe sleep apnea is connected to depression.
Well, there was a new study coming out from the CDC that looked at the link between sleep apnea and depression, and they did find that those who suffered from sleep apnea had a much higher rate, double in men and 5 times as high in women, of having depression. Now, we don't know if it's a cause and effect or an association, but, Madeline mentioned that it's very common in obese people. Now, what's happening is they have a lot of tissues around their neck, and what happens when they're sleeping is, the tissues, soft tissues in the back of the neck kind of collapse and close the airway. So it's really important that obese people in general are aware of this, but even thin people can have it too, especially if they, for hereditary reasons, have a narrow airway.
A lot of people don't realize they have it. Real quickly, what are the symptoms that you have it if you aren't noticing that you're waking up?
Right. Well, because you're waking up so much in the middle of the night, you may have a lot of daytime drowsiness. You may be irritable during the day. Loud snoring is one, and if you have a partner who's sleeping with you, they may notice that you stop breathing for a few seconds and then very abruptly wake up and start snorting and gasping for breath. You may not really be aware of this at all.
And Madeline, what are the risk factors?
The risk factors are certainly, number one is obesity, and moderate obesity, severe obesity. If you have a wide neck circumference, as Rashida was saying, that's something where these tissues can kind of flop to make your airway smaller. So a man with a 17-inch collar, for example, women almost the same. If you smoke, that's a risk. If you have high blood pressure. So you have to be aware of this. But there's some good news in terms of there are some lifestyle things that can help in addition to a medical assessment.
The number one thing you would put,
is going to be lose weight. So
yeah.
the thing is, even if you can't lose weight, that's tough, and that's over time. But even just 10% of your weight, if you weigh 200 pounds and lose 20 pounds, that can help a lot to resolving this.
Sleeping on your side, Dr. Raj?
Sleeping on your side, because when you're on your back, that's when those tissues can really fall backwards and close your airway. If you sleep on your side, it's better. And a little trick to help you sleep on your side, sew a tennis ball to your pajamas so that when you're on your back, it's going to be so uncomfortable, you're going to know, your body's going to tell you turn to your side.
Okay, that's a high-tech solution.
Yes.
Okay, Madeline, you also say better to avoid alcohol, dietary supplements, and limit caffeine.
Well, it's actually limiting caffeine because you're drowsy during the day, you're trying to perk yourself up, so you want to limit that so you get a better night's sleep. Also, you want to avoid alcohol, and it's not really dietary supplements, it's sleep supplements, over-the-counter or prescription, because that will help to relax those muscles around your throat, and you want to keep them open. So you do exactly the opposite of what you should if you have sleep apnea. You want to get a good night's sleep, so skip those things.
Very quickly, nasal sprays, can that help with sleep apnea?
Well, the best treatment for sleep apnea is the machine called a CPAP machine, continuous positive airway pressure, and that basically is a mask that you'll wear at night to keep your airway open. In some rare cases, the sleep apnea is due to problems in your nose, like nasal polyps. In that case, nasal sprays can help. The bottom line is, if you even suspect you may have it, talk to your doctor. It could have many life-threatening complications.
All right, Dr. Raj and Madeline, for some good information. Thank you.
Thank you.
Coming up, you take